A fever is defined as an increase in body temperature above the normal range of 97.7 degree Fahrenheit to 99.5 degree Fahrenheit or 36.5 degrees centigrade to 37.5 degrees centigrade. A fever is usually a sign that the body is fighting an infection or illness. Fevers are common and usually harmless in children and adults, but can be more serious in infants and older adults. The body's temperature is regulated by a part of the brain called the hypothalamus. A fever is considered to be a normal response to an infection or illness and is not usually harmful. Fevers are typically caused by infections, such as a cold or flu, but can also be caused by other illnesses such as autoimmune disorders or cancer. A fever is usually considered to be a temperature of 100.4 F, 38 C, or higher. Fevers are often accompanied by other symptoms such as chills, sweating, headache, muscle aches, and fatigue. A fever can be measured using a thermometer, which can be placed in the mouth, rectum, or armpit. Fevers can be treated with over-the-counter medications such as acetaminophen or ibuprofen. Drinking fluids and getting rest can also help reduce the symptoms of a fever. It is important to monitor a fever to ensure that it does not become too high or last too long, as this can be a sign of a more serious illness. High fevers can lead to seizures in some people, especially children. A fever can also cause dehydration, so it is important to drink plenty of fluids when experiencing a fever. Fevers can be caused by a variety of infections, including bacterial, viral, and fungal infections. Fevers can also be caused by certain medications, such as antibiotics, or by exposure to toxins or chemicals. A fever is often a sign of a bacterial infection, which can be treated with antibiotics. Viral infections do not respond to antibiotics, and treatment typically involves rest and hydration. In some cases, a fever may be a symptom of a more serious illness such as meningitis, pneumonia, or sepsis. Infants under 3 months old who have a fever should be evaluated by a healthcare provider. Children and adults with a fever that lasts for more than a few days or is accompanied by severe symptoms should also seek medical attention. A fever is a common symptom of COVID-19, along with cough, fatigue, and difficulty breathing. Fevers can also be a side effect of some COVID-19 vaccines. Certain factors can increase the risk of developing a fever, including being young or old, having a weakened immune system, and having a chronic illness. Fevers can be prevented by practicing good hygiene, including washing hands frequently and avoiding close contact with people who are sick. In some cases, a fever may need to be treated with prescription medications such as antivirals or steroids. A fever can affect the body's ability to fight infection, so it is important to get plenty of rest and avoid stressful situations when experiencing a fever. Fevers can also affect the way medications are absorbed by the body, so it is important to talk to a healthcare provider before taking any medications while experiencing a fever. A fever can cause changes in appetite, so it is important to eat a healthy diet and stay hydrated when experiencing a fever. Fevers can be a sign of an underlying medical condition, such as rheumatoid arthritis. As we come to the end of this video, I hope you have learned something new about fever and its impact on our bodies. Remember, while fever can be a sign of illness, it is also a natural defense mechanism that helps our body fight off infections. If you or someone you know is experiencing a fever, make sure to monitor their symptoms and seek medical attention if necessary. Stay healthy and thank you for watching.